Good morning, it's Dr. Rapiti. Welcome to another video. It's Tuesday, the 2nd of August 2022, and today I want to talk about something that's been being discussed for a long time in South Africa by many of the citizens and viewers, and that's the health amendments to the Health Act, which is a serious issue, and I don't think many people understand or grasp the severity or the intent of these amendments. From the outset, I need to state that these are draconian, they're unnecessary, and I will justify why I'm making such heavy descriptions on this amendments. and further, I just feel that there's just no open dialogue. When something is being passed in Parliament without public knowledge, without open dialogue, then it's not democratic. It's really communist China, and we become that. Let me just explain to you what this means. If you recall, when we had the so-called COVID outbreak, which I believe wasn't really an outbreak, it was overplayed and abused, but that's a discussion for another time. We had what was called an emergency or disaster management team called the Central Command Council, headed by none other than Nkosazana Zuma, Dlamini Zuma, but we know what a wreck that ended up with the banning of alcohol and cigarettes. But nevertheless, they were considered the experts, which I doubt many of them really are. If you look at the way they conducted this whole pandemic and how they handled it, was a dismal failure. And we can look at it in hindsight and realize that we cost this economy an immense loss of money, livelihood, businesses, and so on, and we didn't do it in if you had to look at it in its totality, it was a useless policy. But nonetheless, that is how 10 people would get together as experts and come up with an emergency. Now, we need to understand something. What the government plans to do is to take this emergency kind of policy that they use for COVID and incorporate it into the general health amendments. In other words, it will be a permanent thing. And there's a serious problem about that, because an emergency policy is designed for a particular emergency where the policy would be specific for that. And we don't know what tomorrow's emergency is going to be. So you cannot create an emergency policy today for an emergency you don't know tomorrow. Unfortunately, the way these amendments are going about, it's going on a very presumptive basis to make it appear that we're going to have this COVID situation for the rest of our lives. And what the minister is now doing in these acts, and if you look at it, it's in sections 15A to F and 16.1. If you bother to go into the Health Amendments Act, you will see that. Very worrying for me is that the minister in this amendment states clearly that if you are suspected of having a notifiable communicable disease, notice the words notifiable communicable disease, you need to isolate, take treatment, or report yourself to a center to say that you have it. Now, that's not easy to determine who's got a notifiable communicable disease, because one of the problems I have with that definition, it does not state what are the criteria for a notifiable disease. And if he doesn't know, it's quite simple. If a disease is a threat to fellow humans, basically that, to fellow humans and to society, and could endanger their life, then such a condition should be classed as a notifiable. And then what is communicable? Is it something that you pass off with a rash? I don't think that's really communicable. And what degree of people are affected? This is the whole point. With a respiratory virus like Omicron 5, it's so widespread. If anybody can get it, it's communicable. Now, so to a large extent, what we're talking about is things like respiratory disease. Of course, cholera would be another one, it's a waterborne disease, but that would be specific for a particular group of people working in a particular area affected by that contaminated source of water. When we're looking things at a national or global scale, the only one I can think of is a respiratory illness, and the most common symptom to make one suspicious of having, if it is so, a disease would be a cough. And now that is so nebulous because a cough is common to many other non-notifiable conditions. To list a few of them would be chronic obstructive airways disease, which is a smoker's lung. Emphysema is people exposed to fumes, sprays, and mining dust, which is a lifelong illness with a lifelong history of cough. Chronic bronchitis, also another condition that comes through constant inflammation and is part of the obstructive airway. Then cancer of the lungs could also give you that. Then there are heart failure is another one. Just to list just a few situations. An upper respiratory tract infection could also give you a cough. The question is, what period of time would one be considered to be having be suspicious of a notifiable disease? 1 week, 2 weeks, 3 weeks, 4 weeks? Well, the point is this: with Omicron, you don't get the cough within about 3 days, and Omicron 5. And I think there are other symptoms that one needs to take that are specific for Omicron. If you're going to wait 6 weeks, you've probably got totally damaged, irreparable lungs. So I think the criteria is not being laid out for what is notifiable, what is communicable. And the danger about this is by putting it in law, what could happen is that anybody who is having a bad cough because they've had a bad bout of asthma could be deemed as suffering from a notifiable disease and as being negligent and not going for help. And if your neighbor down the road doesn't like you, you could say that there is such a so-and-so person that's been coughing all night and he's not taking treatment. I think you should go fetch him. And you could be fetched, according to this law, by the police, taken to a quarantine center and be given treatment that the minister thinks that is required for your condition without even establishing whether you have a notifiable disease by a medical health officer who is going to take away your rights of consent and give you what is directed to give. So you have no recourse to defend yourself, and protect your bodily right. And this is where the problem is. And the danger is that if you refuse to take this treatment, you could be locked up for 1 to 10 years. So this is a clear violation. And the problem that I have with this is that should the treatment, for example, like this vaccine, not work and have adverse events, what recourse do we as citizens have? And I feel this seems to be a ploy to push the vaccines down our throats, even though we now know they're not effective, they're not safe, they're costly, and the virus that we're dealing with now, Omicron 5, is not a serious strain, and it can be treated should there be any complications. So the danger here is that the minister has now been given draconian powers to use draconian laws or policies on the unsuspecting public, and we have no recourse. This only happens in communist China. Unfortunately, this bill is going to be passed on the 5th of August, unless all of you decide that you are going to protest and raise your objections to this bill. I would urge you to please go onto my Telegram site. I'll give you the list of names that I have ordered, but please find them out. It'll only take you a minute or two. Please go ahead and do it. I would urge you to. The other thing that is of concern to me is that he's limiting the number of people at gatherings like churches and funerals, which were totally useless. They don't work. Churches have been destroyed. People's place of peace, hope, and prayer have been taken away from them. I would expect businesses and churches to get onto this fight and stop these amendments, because it's going to affect you. It's affected our businesses, our country. We don't need these laws. They are draconian. They make no sense. Let the minister come out and debate. He shouldn't hide behind the apron strings of government rules and regulations. He should face us and tell us why he is doing this. Lastly, I would urge you all to please support SA VARES. They're doing a wonderful job. Even if it's a 10 or 20 rands, please do your bit for the injured the vaccinated injured. Thank you very much, Dr. Rapiti.